You know that image, right? The clean slice of a scalpel, the surgeon's steady hands. It's the picture of a modern medical miracle. But what happens after that last stitch is in place? Well, that's when a whole other battle begins, a hidden fight against an invisible enemy, infection. Today, we're going to go under the skin to really understand this risk and, more importantly, how the medical world is fighting back to keep every single patient safe. Just think about that moment before an operation. It's this wild mix of hope and, let's be honest, a little bit of anxiety. You're putting an incredible amount of trust in the skill of that surgical team. But while they're totally focused on the precision of the procedure itself, there's always this unseen challenge lurking. The real fight, a lot of the time, actually starts in the quiet moments of recovery. So to really get this, let's look at a real-life case. We have a 75-year-old patient, we'll call her LM, who had successful heart surgery, a coronary artery bypass. The surgery itself, it went perfectly, a total textbook success. But then, just 2 days later, a sign of trouble. A yellowish discharge from her surgical wound. That unseen enemy had found its way in. What LM was going through has a name. It's called a surgical site infection, or SSI for short. The CDC has a really simple definition for it. It's an infection that happens after surgery, right there in the part of the body where the operation happened. Think of it like this. The surgery creates an opening, and that's like an open door for harmful microbes to invade the body. Now, you might be thinking, okay, but this must be pretty rare, right? Well, the numbers tell a kind of different story. Somewhere between 1% and 3% of all surgeries that happen in a hospital result in a surgical site infection. That percentage might sound small, but when you think about the millions and millions of surgeries performed every single year, that adds up to a huge number of people whose recovery gets dangerously complicated. And to put a real number on that percentage, get this. In 2021 alone, over 21,000 SSIs were reported to the CDC. That's 21,000 individual stories of pain, of longer hospital stays, of really difficult recoveries. So yeah, this is not a minor issue. It's a major public health challenge. Okay, so we know SSIs are a serious problem, but to fight them, you first have to understand them. What exactly is going on here? See, it's not just one thing. It's a threat that can operate on a few different fronts. So let's dive a little deeper and explore the anatomy of this infection. This diagram here is actually key to understanding what's happening. An infection isn't always just a surface-level thing. It can be superficial, just affecting the skin, but it can also go deeper, into the muscle and the tissue, or, in the most serious cases, it can get all the way down to the organs themselves. So here they are, the 3 levels laid out for us. You've got superficial incisional, which is pretty much just skin deep. Then it gets more serious with deep incisional, which reaches down into the muscle. And finally, the most dangerous one, organ/space, where the infection is attacking the very area the surgery was trying to fix. And obviously, each level requires a different, more aggressive response. And this all leads to a really important question. If operating rooms are so sterile, how do these infections even happen in the first place? It's easy to think there's just one single thing to blame. But the reality is, it's rarely just one thing. It's more like a perfect storm, where a bunch of different factors all come together to create the perfect conditions for an infection to grow. An SSI is really the result of this complex dance. It starts with the patient themselves, their overall health, how strong their immune system is. Then you factor in the procedure. How long is it? What part of the body is it? On top of that, you have the specific microbes that might be around. And then, maybe the most critical factor, how well did the hospital's defenses hold up? When all those things line up in just the wrong way, an infection can take hold. And here's the thing. Medical teams are on top of this. They actually classify surgeries by their contamination risk before they even make the first cut. A clean wound, something like a hernia repair, has a pretty low risk. But a dirty infected wound, where there's already an infection present, that's a high-risk situation from the get-go. This system lets them customize their prevention plan for the specific challenge of each surgery. Okay, so we've looked at the problem. It's complex, it's serious, and yeah, it can be a little scary. But this is where the story turns. The medical community is not powerless here, not by a long shot. They have a playbook, a whole set of proven strategies to fight back and protect patients. This is how they build their defense. If there's one number you take away from this whole thing, please make it this one. 60%. A staggering 60% of all surgical site infections are considered preventable. That's not a small piece of the pie. That is the majority. It means that most of the time, these complications aren't inevitable. They happen when prevention fails, and it proves that using the right strategies can make a world of difference. So what do these prevention strategies actually look like? Well, a really key part of the playbook is a powerful little mnemonic called CAPTAINS. Think of it like a pilot's pre-flight checklist for surgery. It's a whole bundle of best practices, and when a team follows all of them, it creates this powerful shield of protection for the patient.
So let's just break down a few key parts of this checklist. C is for clippers. Why? Because razors can create these tiny little nicks in the skin, perfect hiding spots for bacteria. A is for an alcohol-based skin prep to make sure the whole area is sterile. P stands for prophylactic antibiotics, basically an internal shield against any bacteria that might sneak through. And S is for sugar control. High blood sugar can actually weaken your immune system, so keeping it in check is vital for the body's own natural defenses.
Now let's just focus on those prophylactic antibiotics for a second, because they are an absolute cornerstone of prevention. But with them, timing is everything. It's literally a race against the clock. The guidelines are crystal clear. That antibiotic has to be flowing through the patient's veins within 60 minutes before the first incision is ever made. This makes sure the body's defenses are at their absolute peak right at the moment the risk begins. So after going through all of this, what are the key things you should remember? Because understanding this issue isn't about making you scared. It's about empowering you with knowledge. So let's bring it all home. Surgical site infections, yes, they're a serious risk, but they're not some big mystery. We understand how and why they happen, we know there are 3 different levels to worry about, and we have a powerful playbook, like that CAPTAINS framework, to stop them. And the great news, the most important part, is that we know this playbook works. The bottom line is this: prevention is incredibly powerful, and a well-prepared medical team makes the vast majority of these infections a non-issue. And that knowledge should give all of us more confidence in just how safe modern surgery really is. The progress in surgical safety has been nothing short of incredible. These prevention strategies have saved countless lives and made surgery safer than it has ever been. But the work isn't done. That 60% figure is a huge win, but it leaves us with a really exciting question, doesn't it? What's it going to take to conquer the other 40%? What new breakthroughs in science, in technology, in procedure will finally let us close the book on surgical site infections for good and make every single surgery a story of pure, simple healing?